protection under the social, the people with severe disability are incorporated and are being paid for under the Social Health Authority. That way, they will not incur any cost. The government will take care of them in matters in matters health insurance. Additionally, we ensure that the medicines are again cost effective, and we are having cancer reforms ongoing to ensure that we promote inter-county engagement between KEMSA and the county. Thank you.
Next, if she has responded to the 2 questions, supplementary questions, or 1?
Honorable Speaker, I'm not too sure that she has responded to the second one, reorganization of KEMSA.
But also, Senator Catherine, you know, your question was not related now to the KEMSA issues, but was on these drugs for the PWDs. Because standing on the 51C7 is giving us very clear guidance that 2 supplementary questions that relate to that question. Because, and also I'm speaking out to all the, obviously, Madam CS, I'm now speaking to all the senators in the House. I know how there are so many questions that you would wish to ask. But then these questions should be grounded on this, the principal question that Honorable Catherine Muma asked. So maybe, because it is your question, let me give you that opportunity. But next, I will not entertain any questions outside the primary question, so that we can make progress. And also, there are many questions, 3 other questions, which maybe if you wait, the issues you are listing now still can be dispensed of during the other questions that we have, because the CS has 3 more questions to attend to. Madam CS, on the reorganization of KEMSA to fit the county issues and remove it as a national entity. That's the question she had asked.
Honorable Speaker, Honorable Member, I kindly request for us to have a comprehensive report from KEMSA detailing what policies and reforms are there to ensure that we have this inter-county partnership. So I kindly request to go back with my team. That way we can have a comprehensive report on the same.
Okay. That's okay, but kindly remember to bring the report as you have committed to do. Next is Senator David Wakoli Wafula.
Thank you, Honorable Speaker. Question number 014.
It's whether you have a supplementary question to this question.
No.
Okay. Your time is coming. Senator Manzo Daniel.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask, in relation to the question asked by Honorable Muma, and I want to state that I have confidence with the CS because she's a medical doctor on this particular issue. What efforts have you made to educate the public on such people who get seizures? Because the moment somebody gets a seizure, Kenyans tend to run away from them. And in relation to the counties, have you worked with the health promoters or a policy so that health promoters could also teach common Kenyans how to give first aid in case of a seizure? And probably you could use this forum to educate the Senate and Kenyans on what should happen should you get a seizure. You see somebody fall down, what is the immediate thing you should do to save that life? Thank you, Mr. Speaker.
Madam CS.
Thank you very much, Honorable Speaker, honorable members. Yes, indeed, seizures is one of the areas that is facing a lot of challenges for patients with the discrimination and alienation of the same. And so as a ministry, we are really working towards ensuring that patients receive, fast management, part of it being through advocacy. We are also leveraging on our community health programs to ensure that we have guidelines and curriculums that are easy for them to utilize. Again, for the school health programs to ensure that these epilepsy and seizures are equally able to be managed before they are referred to the facility. So we are having policies. Yes, we have policies, we have guidelines, we are leveraging on community health promoters, we are educating our healthcare workers on the same so that we improve the management and reduce discrimination of the same. Thank you.
Senator Waheti Duati, Veronica.
Honorable Speaker, my question would fall under, my supplementary question would fall under question 10 by Senator Enoch Wambua.
Okay.
So I'll not push it now. I'll wait for the that moment.
Next, Senator Olekina Redam.
Thank you, Mr. Speaker. Mr. Speaker, my question is directly related to the responses given by the Cabinet Secretary on the question asked by Senator Muma. Now, Cabinet Secretary, you've indicated that the biggest challenge is the debt owed by county governments, about 6.2 billion to KEMSA. You've also indicated that SHA, which you know very well, that in the financial year 2024-2025 was allocated a total of 25 billion 798 827 666 shillings, which is up from the initial of 11 billion 899 413 839, which means there was an additional 13 billion allocated to SHA to be able to ensure that they provide this medicine to the people. If we are having problems